just checked my doctor's orders and they have ordered a catheter for my patient. And so I'll gather all my equipment and I will go into the room. Knock, knock. Hi! So the doctor ordered a catheter for you today, and it's just going to go into your bladder to help you get urine out. And do you have any questions? Perfect. Okay, now before we begin, I'm going to make sure that you are who you're supposed to be. All right, Chris. And can you tell me your birthday? Perfect, thank you. Okay, so we verified the patient. Now, okay, so I'm just gonna clean you up before we get started. So I'm gonna perform hand hygiene. And then I'm gonna come grab some gloves. Maybe. And we're just going to check the perineal area, make sure it's clean. And also, while we're down here, we can position the patient. So I'm just going to clean you up with some wipes. It might be a little cold, and I'm sorry. And I'm gonna just position you so that we can put the catheter in. Okay. His legs, or her legs don't spread very far. Okay. So we're just gonna wipe you. Do one side. And the other side. And then down the middle. All right. Now we'll dispose of those and perform more hand hygiene. Oh geez, I got a lot. Okay, so I brought a pair of extra gloves so that I don't have to leave just in case. And we're going to move this so that it can always be in my field of vision. Maybe. Okay. And I'm going to raise the bed. To a comfortable working height. Maybe sit up just a little bit. Not a whole lot. Okay, now we are going to insert the catheter. So I just touched all that stuff, so I'll wash my hands again. Okay. Now, we'll save that so that we can put the proper labeling and use it so we know that it's the right patient. And so we'll open this away from me, staying in the 1-inch barrier. Oh boy. Just a smidge. No. Okay, so this will be my downfall. Okay, so I'm gonna grab these, and away from the sterile field, I have too much stuff on this desk. We're gonna put them on. pretend I did not do that. Okay. And oh my gosh. Thank you, my lovely assistant. And we'll keep our hands up so that we don't contaminate our clean, sterile gloves. And then we'll lay down a little sort of sterile field next to the patient. Be careful not to touch the patient or contaminate my gloves. I'm just gonna... And then there's another one, and I guess it probably, we'll just put it on there. Doing the same thing, careful not to touch or contaminate your gloves. Okay, and then we'll get all our stuff ready. So, we've got some swab sticks that will open up so we're not fighting them later. Just keep all your supplies within the sterile field so that you don't have to start over, because that would not be fun. And we'll open this up and get it ready so that we can use it so that the catheter goes in easier. And hook this up so that it's ready to go. And if we need to get a urine sample, we can loosen that and have it ready to go. And so we'll carefully take this out. We don't want this flipping all over the place. And then we'll just sit that in the loop, being sure that it's all in sterile filled. And then we'll hook this up so that we can pump up the little balloon once we get it inserted. Okay, now we're going to provide more peri-care to make sure that it's all clean and sanitary. So I'm not going to turn my back to this, but I can't push it any farther over the bed, so I'm sorry. And so we're going to spread this, and now this hand's no longer sterile. Avoid this plastic. And we'll do one side. Next side, pretend that landed in the garbage can, and then down the middle, and then we're gonna let them know that now we're going to be inserting the catheter so that there's no surprises. But first we're gonna, there's not a whole lot of room over there because her legs don't spread very well. But we'll just pretend her legs are even more spread and they're not, nothing is getting contaminated. And we're just gonna insert the catheter. And, okay, I'm just gonna insert this And we're gonna go until we get some urine. And then we're gonna go 2 inches past the point where we get the urine. Oh, this plastic really fights you. Okay. And then we're gonna inflate our balloon with 10 milliliters and then that will keep it in place. And we're just gonna give a gentle tug to make sure that it's not gonna come out. And then you can just get this out of the leg. And then we're gonna secure it to the leg with do some skin prep so there's no wearing down of the skin, and we can get this out of the way. And then we're just gonna attach this to the bed frame. Okay, and then we're going to clean up and let them know that they're all done and ask if they have any other questions. And then we're gonna, okay. So now that's in. Do you have any questions? No? And then we'll clean them up if they had any drainage or anything, doing the one side and the other side. Middle. And then we'll cover them back up and get them all comfortable and return the bed to a comfortable position. He wants to watch TV, so we'll just sit him up. Okay, and then I'll be back and I'll remove your catheter. So we'll get this all cleaned up real quick. And we're gonna, oh, I threw my, I did not throw that away. This is a fresh, oh, is this from yours? It's got stuff in it. Oh boy. Okay, we have a fresh syringe that we're going to use. Okay, so just check the doctor's orders. They are ready to take this catheter out of our dear Chris, and so we're going to come in. Hi, I'm Kylie. I'll be your nurse. We're going to be removing your catheter as per doctor's orders. And I'm just going to verify. Okay, Chris. And can you verify your date of birth for me? Perfect. Okay, you are who you say you are. And so I'm just going to pull down your blankets and we're going to get that catheter out of you. Oh, before I did all this, I removed my gloves, washed my hands, and now I've got some fresh gloves on. And so, okay, we're gonna unhook this from your bed rail, and then we're gonna untape you, and now we're gonna deflate your balloon. Make sure you're getting as much out as you put in. Goodness. Pretend that did not happen. Now, I'm going to have you take a deep breath and we're going to pull this out, okay? 1, 2, 3. Okay, and it's out. And just inspect the area. Clean it up in case there were any drips. One side, other side, down the middle. And okay, and then we'll just cover you back up, make sure you're comfortable. If you have any questions for me, and then we will document. And I documented before, after I inserted the catheter, and I'm documenting again any changes or anything. And have a good day.